Hi, welcome to this unique hair care initiative by IPCA. I'm Mona Sharma and it's my pleasure to be your host today. This unique initiative seeks to provide expert advice for various issues connected with hair care. Our hair is a crowning glory and it makes a world of difference to our appearance. However, our hair also requires special care and attention. Earlier, it used to be a sign of middle-age problem when you used to lose hair or have thinning of hair or bald patchy hair. However, with increasing pollution and the increase of stress in our daily work life, we are now seeing hair problems occurring even at a younger age. It is not uncommon now to see 25 to 35 years old people complaining about hair problems. Most of these problems, if identified early, can be managed well and much of the hair loss can be avoided. Today we have with us Dr. Neha Agrawal is a well-known dermatologist and has been practicing medicine for over 20 years now. She's MBBS, MD in dermatology and cosmetology. She's directed at Ecos Clinic and she's also current consultant dermatologist at Jeevanrekha Hospital, Jaipur. Dr. Neha Agrawal has dedicated her career to diagnosing and treating a wide range of hair and skin conditions while providing healthcare services to her patients. She takes time to listen to her patient concern and work closely with them to develop a treatment plan that meets their individual requirement. Dr. Neha is aware of the need for the patient awareness and education about hair care and spend a lot of time in giving talks at various platforms across the country. Thank you, Dr. Neha Agarwal, for sparing your valuable time to answer a few questions on hair care for us today. Welcome to the show. डॉक्टर हमारे साथ जुड़ने के लिए बहुत बहुत शुक्रिया.
So much.
So, doctor, you're little not audible. I think
Hello. Am I
yeah.
audible?
Yes, doctor. Yes, doctor.
Okay,
Thanks so
okay,
much, doctor. Yeah.
okay.
So doctor, we are going to discuss about hair care in current scenario. So,
Okay.
whenever we talk about hair care in current scenario, the first and the foremost problem which is faced by all of us, irrespective of gender or age, is the hair fall. So, doctor,
Yes.
can you enlighten us today, like what is hair fall and is it normal?
Yeah, some of the hair fall is normal. If you are losing 50 to 100 hairs per day, then it is considered totally normal, as it is part of normal hair growth cycle. But if you are losing more than this, if you are losing more hairs per day, then it is such. If you are losing in clumps, or if you're having excessive bald patches, and the hair loss is sudden, then you should be considerate about it.
Okay, doctor. So, with your profound experience, doctor, today we have a chance to know, like, what are the alarm sign for the hair fall that, okay, this is the time we should visit to the doctor, which should not ignore the hair fall.
Yeah, as I told you that if you are losing 50 to 100 hairs per day, that is considered as normal. If you are experiencing excessive hair loss, hairs are falling out in clumps, there are certain bald patches are there, and you're having permanent kind of hair loss, male pattern baldness or female pattern baldness. Male pattern baldness we recognize as this uh, receding of frontal hairline, or in female pattern we recognize it as parting of widening of hairline, widening of the central partal hairline. So if you're having this, then you should definitely consult your dermatologist.
Okay, so excess of hair loss and अगर कहीं से आगे से या पीछे से ज्यादा hair loss हो रहा है तो डॉक्टर को
ज्यादा
विजिट.
हो रहे हैं तो हाँ.
Okay. So doctor, common people like us, हम लोग को तो ये भी नहीं पता है transplant होता क्या है. So please, can you enlighten us today? What is hair transplant for us
Yeah,
for
hair
us?
transplant. Yes, hair transplant is a surgical procedure which is done for hair fall. Hair loss जिनको हो जाता है उनमें हम करते हैं hair transplant. तो हेयर ट्रांसप्लांट में क्या होता है, हेयर फॉलिकल्स आर टेकन फ्रॉम डोनर साइड एंड दे आर ट्रांसप्लांटेड टू द रेसिपिएंट साइड. तो यूजुअली डोनर साइड में जो बैक ऑफ स्कैल्प है या फिर साइड ऑफ स्कैल्प है, वहां से हेयर फॉलिकल लिए जाते हैं एंड दे आर ट्रांसप्लांटेड टू, जैसे फ्रंटल में ज्यादा लोगों को लॉस होता है या टॉप पे लॉस होता है, तो वहां पे वो ट्रांसप्लांट किए जाते हैं. एंड दे आर मोस्टली टू टाइप्स ऑफ दिस हेयर ट्रांसप्लांटेशन, FUE एंड FUT. In
Hmm.
FUT, a strip of scalp is taken out and it is transplanted to the recipient area. Whereas in FUE, individual follicular units are taken and they are transplanted to the this recipient area. And FUA is less invasive as compared to FUT. So like
Okay,
that.
so
Yeah.
okay, doctor. Very interesting, doctor. So, doctor, आजकल कितने सारे डॉक्टर्स हैं, like MBBS हैं, dermatologist है, cosmetologist है, trichologist है. So, whom to refer and when to refer for hair transplant?
Yeah, obviously, a doctor should be board certified. You know, it should be a dermatologist or either or hair transplant surgeon, and you should not go for this cosmetologist, trichologist, and all. And whenever you're having this permanent kind of hair loss, as I already told you, male pattern baldness or female pattern baldness, जैसे फ्रंटल एरिया से अगर बाल पीछे जा रहे हैं, टॉप से बाल पीछे जा रहे हैं, या फीमेल्स का पार्टनिंग वाइड हो रहा है, तो हम हेयर ट्रांसप्लांटेशन पे जा सकते हैं. स्टेबल हेयर लॉस है, बहुत टाइम से लॉन्ग स्टैंडिंग एक ही जगह पे बाल पैचेस बने हुए हैं, देन यू कैन गो फॉर हेयर ट्रांसप्लांटेशन. इफ the hairs are affecting your quality of life, your self esteem, then you can go for hair transplantation.
Okay, okay. So,
But
मतलब
always remember that you should get yourself treated by a board certified doctor, dermatologist, or hair transplant surgeon.
okay. So, the most common for the hair transplant is the dermatologist, not MBBS or any other physician. We should visit
So,
to dermatologist.
dermatologist or either qualified hair transplant surgeon.
ओके ओके डॉक्टर. सो डॉक्टर, दूसरा क्वेश्चन हम कॉमन पीपल को नहीं पता है कि हम डरते भी हैं कि इज हेयर ट्रांसप्लांट सेफ और नॉट, और इज देयर एनी कॉम्प्लिकेशन आफ्टर हेयर ट्रांसप्लांट?
Actually, hair transplant is generally considered safe. It is not as such harmful. But just as I already told you, you should always get it done by a qualified doctor. And if you are getting it done by just cosmetologist and all and MBBS video, so it may cause you some side effects. But like any other surgical procedure, it may have its side effects. Like you may have experienced pain and discomfort, swelling over that area, or inflammation, itching, pain, discomfort. But usually these side effects are very mild. So they can be managed with painkillers and all. So it is actually very safe procedure.
Okay,
Nothing to
so
worry about as such. Yeah.
okay,
And so
interesting. So
whatever your dermatologist or your doctors telling to take care of, you should follow the instructions and it will be a good thing for you. Yeah.
so with a certified dermatologist, it is a safe procedure, and whatever complication we can have, doctor will help us to manage it.
Yeah, we can handle it very easily. Yeah.
Yeah. So, Doctor, another question is that does hair transplant procedure hurts? Because it is kind of like even if we pull our hair, we feel so hurting. So, is the procedure is hurtful?
During the procedure, you won't feel any kind of pain, but before the procedure, we'll give you local anesthesia. So you will have mild pain during that anesthesia, but during the procedure, some patients may feel some kind of pressure or a bit of discomfort, not more than that. And after, when the anesthesia wears off, then also you can experience mild pain. But there's nothing like you'll have more pain or something like that, nothing like that. But the for this pain also, we can give pain relievers. So nothing to worry as such.
Okay, so it's a like मतलब हम bear कर सकते हैं इस टाइप का
बेयर
कोई.
कर सकते हैं इजीली. ऐसा कोई वो नहीं है कि आप पेन की वजह से नहीं करवाना चाह रहे हैं, तो दैट्स नॉट अ थिंग.
एंड पोस्ट प्रोसीजर भी कोई पेन नहीं होता?
Post procedure, mild pain, mild discomfort. For that, for managing that, painkillers are given, so they
Okay,
can be easily managed with those painkillers.
okay, so nothing to worry about, and we
Nothing
can
to worry
easily.
about pain. नहीं.
Okay, doctor. So, like, doctor, there is a lot of like in social media also, like many and many public places also. It is like 99 में hair transplant करा लो and all. These kind of ads are going on. So, can you please enlighten us today? What is the cost for hair transplant in India? Like, which is like reliable and we don't think it's a fraud.
Actually, the cost of hair transplant varies, depends on various factors. If you are getting it done by a certified dermatologist or certified doctor, then obviously it will cost much, and it depends on which city you are taking it from. and qualification of the doctor, reputation of clinic. These are all factors that decide the cost of the treatment. Usually, it costs you around, if you are taking FUE, then it will cost more than as compared to FUT. So around it will cost 30 to 80 rupees per graft. And in case of FUT, it will cost you around 20 to 40 rupees per graft. So 100 to 1000 to 3000 grafts are used in a single hair transplant procedure. So it will cost you around roughly 45,000 to 2.5 lakhs. So it varies depending upon the requirement and depending upon various factors. Usually the minimum to minimum cost is 50,000. Yes.
Okay, so those are like fake like media thing like 9 whole
No,
transplant.
definitely not go for this. No. Always,
Okay.
yeah, you are getting it.
Yeah. Another question is, doctor, like how to choose a clinic, like clinic for hair transplant? How do we like? There are so many, like even in like even like there are so many posters like हमारे पास आ जाओ हम hair transplant अच्छे से grow कर देंगे आपके hair. So how to choose a clinic for hair transplant?
सबसे इम्पोर्टेंट क्लिनिक चूज करने के लिए ये है कि आप जहाँ से भी करवा रहे हैं वो
हम्म,
डॉक्टर क्वालिफाइड होना चाहिए हेयर ट्रांसप्लांट करने के लिए। ऐसा
हम्म,
नहीं कि आप कहीं से भी करवा रहे हैं जो उन्होंने लिख दिया है कि हेयर ट्रांसप्लांट करते हैं, क्योंकि आजकल हर कोई बहुत सारे डॉक्टर्स हैं जो कि क्वालिफाइड नहीं है बट दे आर परफॉर्मिंग इट, सो यू शुड नॉट फॉल फॉर इट। यू शुड ऑलवेज चेक दैट दिस डॉक्टर इज क्वालिफाइड इनफ टू डू द हेयर ट्रांसप्लांट, सर्टिफाइड इनफ। एंड क्लिनिक का आपको देखना है, रिजल्ट्स देखना है, पहले कैसे पेशेंट्स उन्होंने ट्रीट किए हैं, बिफोर आफ्टर उनके इमेजेस देखने हैं, रिव्यूज देखने हैं, तो उस हिसाब से आपको करवाना है हेयर ट्रांसप्लांट। डॉक्टर से बात करनी, यू कैन फिक्स अ मीटिंग विद द डॉक्टर एंड इफ यू फाइंड इट गुड फॉर यू देन यू कैन गो फॉर
yes, because आजकल टेक्नीशियन एंड सलून में भी होते हुए देखते हैं हम लोग.
इट।
So
हाँ, टेक सब कुछ चल रहा है मार्केट में बट यू शुड बी अवेयर ऑफ इट एंड यू शुड नॉट गो फॉर इट।
okay, so it's better to always go for a certified doctor and then choose the clinic. So डॉक्टर एक दूसरा क्वेश्चन बहुत कॉमन मिथ भी है कि क्या केयर करनी चाहिए, व्हाट केयर टू बी टेकन आफ्टर हेयर ट्रांसप्लांट बाय द पेशेंट टू मेंटेन अ हेल्दी हेयर, और इज इट नेसेसरी टू मेंटेन द हेयर इवन आफ्टर ट्रांसप्लांट?
इवन आफ्टर ट्रांसप्लांट देयर आर मेनी थिंग्स टू टेक केयर ऑफ, लाइक आपको जो भी प्रिस्क्रिप्शन जो भी मेडिकेशन दिए गए हैं पेन के लिए, एंटीबायोटिक्स दिए गए हैं, दैट यू शुड ऑलवेज टेक। अवॉइड स्विमिंग, अवॉइड कोम्बिंग योर हेयर्स ना। और कुछ भी हार्शली स्कैल्प इचिंग वो सब नहीं करना है, अदरवाइज इट मे लीड टू इन्फेक्शन। So whatever the instructions have been given to you, you should strictly follow them. Otherwise, you may not get those results that you are expecting. So it is very important to take care of all the precautions.
Okay, so
After
what
the procedure, it is important, yes. And always follow up is very important. You should go for follow up also
yeah,
as per
yeah.
the requirement. Yeah.
या मोस्ट पीपल डोंट लाइक अच्छा हेयर ट्रांसप्लांट हो गया तो अब छोड़ दो, फॉलो अप नहीं
ट्रांसप्लांट
करते.
हो गया उसके बाद आपको फॉलो अप लेना है, आपको जो भी इंस्ट्रक्शंस दिए गए हैं उनको फॉलो करना है, सब ध्यान रखना है।
Okay, doctor, very interesting. So doctor, can you give us some important tips for healthy hair today?
Yes, yeah, definitely. Uh, these are following tips for hair recommend healthy hairs. First and foremost, very important thing is balanced diet. You should always take a balanced diet that is rich in vitamins, minerals, protein, specifically vitamin B12, vitamin D, and iron. Second thing, hydrate. Hydration is very important. Always drink plenty of water, and it will hydrate your hairs from within. Next thing is shampooing. So never use warm water, hot water for shampooing, and use mild shampoo for washing. Next is conditioning. So conditioning is very important as it leads to smoothing of your hairs and it leads to less breakage of hairs. That is very important. And the handling of hairs. Do not comb your wet hairs, otherwise it will lead to breakage of the hairs. And these things are very important. And never use this. You can use but minimize the uses of these hair straighteners and these blow dryers and all. And whenever you are using them, then always use heat protectants over your hairs. And do not tightly tie your hairs, otherwise it will lead to a condition that is called as traction alopecia. You will develop bald patches in the frontal hairline if you will continue
Mm,
use if you will tightly tie your hairs.
mm.
So, and these are important things to take care about
Okay, so even
maintain
tying
healthy
of,
hair.
okay.
Yes,
Okay, doctor, very interesting. This discussion was very informative, doctor. I'm sure our viewers will be benefited by it. So, doctor, can I take some live audience question?
yes.
Uh, Doctor, I have androgenic alopecia, and doctor have given me lot of vitamins and mineral. So, do I need to take those vitamin and minerals for my whole life?
For whole life, not as such, but at least for 6 months you should take them. Other than this, you should maintain healthy lifestyle. You should take food that is rich in those vitamins and minerals. At least 6 months you should complete that course, whatever your doctor has given to you.
Okay, okay. Okay, so the vitamin and minerals do not require to be taken for whole life. It shall like with the for a time period.
You can take it on and off. For 6 months, you should take it continuously, and after that, you can take it on and off. It's not that you cannot take it after that also. So it's fine if you could take it after that also.
Okay, doctor. Okay.
Yeah.
Another question is, hi doctor, how should I take the appointment? And also, I wanted to ask, after my pregnancy, I'm facing a lot of hair loss.
Sorry, you're not audible. Sorry.
Yeah, so she's asking that, hi doctor, I want to take your appointment, and can you please let me know after my pregnancy, I'm facing a lot of hair loss. So is it because of my pregnancy or I have some deficiency in my body?
It is very normal. It is very common to have hair fall after pregnancy. It is a different condition that is called as telogen effluvium. As pregnancy is a very stressful condition, and most of the females pass through this condition. You can
Mm-hmm.
take my appointment and I'll prescribe you accordingly. But keep your lifestyle healthy, keep your food healthy, and I'll have to prescribe some vitamins, minerals, and all. I'll have to look into it that what kind of treatment you need.
Okay, so after pregnancy, every woman faces hair loss
Every
problems.
This is very common.
Okay, okay, okay. Okay. Another question is, hi doctor. 2 years back, I met in a fire accident, and due to which I lost the frontal part of my hair, and somebody told me I can go for transplant. So, is it possible to go for a transplant for a fired area?
Yeah, grafting can be done. In your case, hair transplantation can be done.
Mm-hmm.
Donor graft can be taken from the donor, the back of the scalp, and they can be transplanted to the this fired area. But we'll have to look into it that how much is the area involved and what kind of hair loss you're having. So
Okay,
you can
okay,
visit us.
okay, okay. Another question from the audience is, Doctor, what is difference between hair transplant and hair patch?
Hair patch. Hair transplantation is a surgical procedure. Whereas in hair patch, there are hair patches available in the market and you just have to apply it over your scalp. You can apply it by yourself also.
Mhm.
So they are entirely different thing. Na? Hair transplant is a permanent kind of thing. And hair patch is very temporary. That's the difference.
Okay, 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 okay. I quickly take the last question because we are running out of time.
Okay.
Doctor, I'm diabetic and I have bald hair and I want to go for a procedure. So, can a diabetes patient go for hair transplant surgery?
Yes, diabetic patient can go for hair transplant surgery, but you will have to keep your diabetes, your sugar in check. That is very important. Keep your sugar in check, and you can go for hair transplantation.
Okay, so even diabetes patient or any other patient with any
Any
other
other patient, if you're not
problem.
having any kind of major illness, you can go for it.
Okay, it's completely safe. Okay, doctor. Thank you so much, doctor. So, doctor, would you like to give a take-home message or any other suggestion to our viewers today?
Yes, I want to say this: if you're having if you are having permanent kind of hair loss, you are facing lack of self-esteem, then you can go for hair transplantation. It is a good procedure. It is a safe procedure, and you can easily go for it. Nothing to worry about pain and all. It's very safe procedure, and you can opt for it. And I already told you about the healthy hair, how to maintain healthy hair. So maintain your hairs and take care of your hairs.
Thank you so much, Doctor. Thank you so much for sharing your information and all your expertise with us today and answering all the questions of our viewers today. I'm sure our viewers have found the session very helpful. Thank you, Doctor. It was delight to have you, and thank you so much for your valuable time.
Thank you, Mona, for having me. Thank you for giving me this opportunity. Thank you so much.
Thank you, ladies and gentlemen, for joining us today. We are signing off for today. Thank you. Have a nice